down. So patient position could be sitting or laying down. They're more comfortable or probably more relaxed laying down. Okay. So basically percussion, again, if I suspect a fracture at the distal end of the tibia, I'm not going to tap on that spot. I'm probably going to tap away from the area. Okay, so I'm going to find the tibia right here. I'm going to tap that. It's basically vibrating the bone. Okay, as I do this, and and if that provocates pain or symptoms, that's a sign that he could have a fracture or a stress fracture. Now, if I tap here and he says "ow," I have to ask him, where does that hurt? If he says right where I'm tapping, well, maybe he's, if I'm on the tibial tuberosity, he may have like a, Osgood-Schlatters or one of those, some spurs right here, or maybe he just has a bruise. So if I tap here and he says "ow," and I say, where does that hurt? If he says right there, well, maybe I'm just tapping too hard. But if I tap here and he says "ow," and I say, where does that hurt? And he says down here, that indicates that I'm vibrating the bone and there's an injury down here. Okay, does that make sense? So I'm going to do percussion, or sometimes you can do it this way, tap the heel, okay? And then again, if he says "ow" anywhere along here, if I do this and he says "ow," I'll say, where does that hurt? And he says right there. Well, maybe he's got metaphagitis, something else. So I'm going to tap here, "ow," where does that hurt? Maybe here. Okay, I suspect a fracture. Does that make sense? Same thing, so I could tap here. If I, again, that's the tibia. I could tap here for the fibula, the lateral malleolus. Okay, so lateral malleolus and fibular pain, or the head of the fibula. The fibula is not really palpable except for at the distal portion. I can palpate it there, then it dives into the muscles. You can't really palpate it until you get to the fibular head. So I can palpate or tap here, tap here. So I can do a tap test. So that's known as percussion. Compression is just squeezing the bones together. So again, if I suspect the fracture being down here towards the distal end of the bones, I'm going to do my compression or squeeze test up here. So squeeze those bones. Basically, I'm moving those bones, trying to grind them together. Okay? And then if he says "ow," well, maybe again, he's got a calf strain or something. But if he says "ow" and puts down here, I suspect a fracture. Okay? So squeeze test or compression test. If the fracture's up here, I'm going to squeeze down here. Okay? So we always want to rule out fracture first. So that's probably the first test I would start with. It's doing the compression, the tap, ruling out any fracture, and then going into my other special tests. Thompson's test. Laying prone. Patient is laying prone in Thompson's test. This is a test to check for a ruptured Achilles tendon. Okay, we didn't talk about ruptured Achilles, but that's one that I want you guys to kind of look over. So if they have a torn Achilles tendon, we suspect that they may have torn their Achilles tendon, we put them in a prone position, and all I'm going to do is squeeze the belly of the calf. Gosh, you're so tight. He has, I don't know if you can see this, but he's got plantar flexion. As I squeeze the belly of the calf, his foot plantar flexes. Okay, you can see that? So they get that plantar flexion. So if there was a tear, or the Achilles tendon was torn, I would squeeze that belly of the calf and there'd be no movement at the foot. Okay? But he's got a little very tight. He does have plantar flexion at the foot. Okay? So that's what we're looking for. So a positive sign would be no movement at the foot. Okay? That's the Thompson's test. Hellman sign, flip it back over. Hellman sign is basically we're taking the patient, and this is not for an ankle or leg injury. This is checking for tests for DVTs in the lower leg. So deep vein thrombosis or clots, blood clots in the leg. If you've got somebody who maybe just had knee surgery and has a lot of swelling down here, or something like that, and maybe suspect that they could have a clot, we would do what's called a Homan's test or check for Homan's sign. Okay, and all you're going to do is extend the knee and dorsiflex the foot. So basically, you're putting a big amount of stress on the gastroc. A lot of DVTs happen in the lower leg, and by doing that, they would have excruciating pain, very severe excruciating pain. with just that stretch, all right? Now, they may just have some tight calves, so we differentiate by knowing that there's maybe other signs and symptoms, like we see swelling and descent in the skin, that excruciating pain, and especially with the stretch. So if you suspect that or you find that and you get a positive sign, you need to get them to the doctor right away. So immediately go to either the ER or to a physician right away. So not necessarily due to an ankle injury, but it might be maybe there's a compression or lots of pressure within the compartments of the leg, okay, and there's clot has formed because of the trauma. So it could be due to something like that. A lot of times it may be due to recent surgeries that they've had somewhere else in the body. Okay, so if you do find a positive